all basically you walk in, you problem solve, and you have to know what to do with them. So what I'm trying to say basically is textbook model. Okay. So she's my patient, and let's just say she has a weak left leg. She's got moderate confusion to person, place, date, time, whatever it may be. She can use both of her upper extremities, okay? And our objective is to get her out of this bed and have her sit. Somebody can grab that wheelchair, please. And have her sit in this wheelchair, okay? Now until noon, Mike and Colleen and myself, we're gonna kind of help you guys get familiar with this stuff. From 1 to 3, you're gonna have actual cases to work on, and then from 2 to 3, you're gonna present. So 1 to 2, you're gonna practice. 2 to 3, you're gonna present your case. Okay, all right.
Wait, today?
So,
That's today?
You're the therapist, okay? So I'm gonna let you go in. So here's the door. Put your hand up. You go. Knock, knock. All right.
Wait, my left leg is weak.
Your left leg is weak. Okay. You have a non-displaced fracture of her femur, so there's no surgery involved. She's weight bearing is tolerated, but it's very, very weak. 2 plus over 5. That's it. For her whole extremity. All right.
Knock, knock.
Hi, I'm Susie. I'm a physical therapy student at South University. I'm going to be moving you today into the wheelchair so you can do some exercises.
Okay.
I'm going to ask if test her cognition and
Yeah,
You do what?
What day
So
is it today?
yeah, you do all that stuff, and we'll jump in and we'll discuss that. So I want to see you go through what you have to do, and then we'll discuss it.
All right. Do you know your name?
Regina.
Okay. You know what time, what day it is, where you are.
January 12, 1962.
Okay. All right. Can you sit up in bed? Can you sit up? Like, I need you to get from here to here. Come towards me. There you go. Use your hands. You use your hands. Okay. And we're gonna be. Make sure this is locked. I don't know if that's where I want it to be.
You can put it anywhere you want. In fact,
You said her left leg is the weak one.
Yes.
This one is the strong one. So we probably
Sometimes.
all right, girl.
CrossFit.
Okay. All right.
Oh, there
Yeah,
it
right
is.
there.
That one. That's the one I wanted. Alright, can you swing your leg over to sit facing me, and I'll help you out with your leg, okay? There you go. Good. Yeah. I need to put on her gait belt.
Who has a gate belt?
Thanks, Greg.
Just thought I'd
All right. I'm gonna wrap this around you. She doesn't have any incisions or anything of the sort. that comfortable? Okay.
Flip it the other way. So
And-
the flip goes the other way. Where you second it.
Oh, okay. So this should be inside out.
No discussion yet, just go ahead and finish, just do what you're gonna do. Do whatever you're gonna do, yeah, just, I mean, do your complete treatment, then we'll jump in and we'll say
Okay.
things at the end.
No, I'm saying like you have to like close the clip to tighten it. Like flip it around.
Oh, okay, okay.
Like the clip was open.
I gotcha.
You gotta close it.
Okay.
Yeah.
Alright, and then we're gonna stand up. She is weight bearing on that leg.
Wait for it solid.
So can you stand up? Stand on your feet, put your foot down. Okay. And now little by little we're going to get into the chair. So she can weight bear on this. So move this foot forward. There, okay. Alright. Go ahead and sit down.
Good, that's fine, perfect,
Okay.
good, okay, you can go. All right. All right, guys, so this is your patient, go ahead, lay down. So, you go into the room, and what's the first thing you wanna do? Introduce yourself, so she did that fine, okay? So then, secondly, she attempted to establish whether she had cognition. So she asked her, what's your name? And she knew her name. What year was it? So she didn't know what year it was. What else could she have asked? How are you feeling? Yeah, I mean, how are you feeling? Okay. What else though?
Pain scale?
Any pain? More important,
Changes from the last treatment, last time you were there?
she wouldn't know.
Medication? On any
Too deep. You're thinking too deep. Who said it?
Any medication?
Now, why you're here? Who said that? Yeah. So basically, you ask your patient, do you know why you're here? So sometimes patients know, yeah, I got an accident with you. Do you remember who was there, who was involved, what time it was? No, I got in an accident. So they don't know a lot about the situation. What I want to caution you on is that you're reading the medical chart. You're going to have information that the patient doesn't have. I've made this mistake early in my career, and we all are going to make it. It's just one of those growing pains where you read something in the chart and you share it with your patient when you shouldn't have shared it with them because the physician hasn't shared it with them yet. Like, yes, you got in a car accident and your cousin passed away. Were you aware? Or yes, the MRI has shown that there's a lesion or a tumor. I thought you were aware of that, although I didn't know that. So again, you don't want to give them information about medical conditions if the physician or someone hasn't already informed them of that, because that's not our rule. Okay, you don't want to do that.
But it's say, you wouldn't say in the chart that they know, right? It would just be like, because it's not a.
I'll let Mike answer that. So she's asking what it say in the medical
Yeah,
chart.
case manager will put a note.
Okay.
Patient's not aware of that, doctor died, patient's
Okay.
not aware of that.
Correct, yeah, so we'll have an idea, so that if we're reading that, then we know we can't be the one to share that.
Okay.
All right, so then, secondly, she said, can you sit up? So before that, again, you want to come over and say, can you, so this is where you want to look and see what the function is. Can you move your toes? Can you bend them up and down? Okay, can you bend them up and down? So she's doing, and maybe she's confused, so she's not doing exactly what I'm asking. So now I can get an idea of her cognition. So I'll say, can you bend your left leg? And she'll try, and it's weak, and so I'm helping her. And as I'm helping her, I'm going to be looking for what? Pain, facial grimaces, okay? Whether she can tell me or can't tell me, I'm going to be looking either for verbal or non-verbal reasons why she's in pain. Okay, so then I'm going ahead and I'm getting an assessment of what she can do with this leg. And then I'll say, can you bend this leg? And there's no problems with this leg, okay? In this position, again, you can always kind of put your hand around here and see if there's any tubes, lines, any incisions. Again, remember, they'll have a hospital gown on, so you can get a lot of information just from looking at their body and see if there's any tubes or lines running towards that area. Now, to get out of bed, what's the 2 ways to do it? So one, she can roll. What's the other way? Sit up. Okay, so if she were to just to sit up, so go ahead and sit up for me. So what muscles is she using to sit up? Her abs. Well, go back up. What if she has surgery on her abdomen area, or she has certain precautions where she's not supposed to do that? Then what do we have to do? Okay, so go ahead and bend your legs up, and can you lift your hips up and scoot over? So again, as I'm telling her to do it, I'm actually helping her do that, okay? And now can you roll on your side? This is where you want to tell them now what I would like you to do is I'm going to have you sit up.
Okay.
And then when you sit up, I'm going to have you sit there for a minute and tell me how you feel. Okay, are you ready? So go ahead and sit up. So as she's doing, so I give her one simple command, sit up. If I say, I want you to sit up, and then we're going to try and stand and get to the chair, that might be too many commands for her to process to comprehend. So if someone's confused, one direct command at a time, or maybe 2 at the most.
Tell in advance what you're going to do and then say step by step as you do it?
Yeah. Okay, so go ahead and sit up for me. And I'm watching her how she does. I'm looking at her motor plan. So from here, sometimes patients are going to lose their balance backwards. Sometimes they're going to lose their balance to the side. So they're not always stable. Okay? So what Susie did at this point was she went for a gait belt, which was fine. But she did one thing incorrectly. She walked away. There's many times when I'm with a patient and I've gotten to this point and I know they're not able to sit by themselves. So if I step away, they can fall back down, they can fall forward. So a lot of times what I'm doing is I'm holding my patient and I may be asking for someone in the room to hand my gait belt. Or if I have to leave to go get it, I have to lay it down. Because again, she's under your care. If she falls and gets hurt, it's your fault, okay? Everybody, do you guys have your gait belts with you? So go ahead and grab them if you can right now at this point. And I want everybody to see her now. So he documented a patient with max assist from supine to sitting. Okay? So how much assistance is she going to get?
25%.
25%. Okay? And now, how would I approach that? What's that going to mean for me?
You're gonna be sitting her up?
I have to do quite a bit more.
Yeah,
okay?
75%.
So this is where technique comes in. So Mike might have his own technique. Gabe might has his own. Everybody probably we all have our own different techniques to do this. Okay. So my technique is I want to make sure that I don't hurt myself. Okay. So I'm not a big believer in having somebody try and sit up from this position, from supine to just sit up. It puts a tremendous amount of pressure on the abdomen, and a lot of people are sort of weak in this area. So I wouldn't say, I want to take my hand and come under here like this and say, go ahead and push up. So not only that, not only am I lifting her up, but look where my hand is. I mean, I can hurt her neck. So I'm going to try and have them roll on the side, okay, if at all possible. So I'm going to say scoot your hips over, and again, now roll towards. So I go ahead and I segment the body, one hand for the lower, one hand for the upper. If I need to use a draw sheet, I'm grabbing the draw sheet. If I'm leaning over like this and I feel it in my back, I'm going to come up and I'm going to do this. I'm going to improve my leverage, okay? So from here,
Since her femur's fractured, right?
yeah,
Where you get her lever?
it's non-dis left. So it's non so I can go right here, and again,
Even when she's on her back.
absolutely. So I'm holding her just like this here. My hand comes under here. So as she comes up, 1, 2. So I got her to this point. Then I'm saying, I'm moving my hand from here, because I know gravity's gonna bring her legs down. My point of contact becomes her hip. I want her to use her triceps so I can facilitate by tapping. And then she's coming here, and I'm holding her like this. Okay, so that, I mean, it's easy with her. It would be hard if you had to do me, or do Greg, or somebody else with different sides. Okay? Okay, where's the gate ball? So everybody who has the gate belt, everybody hold their gate belt out. So this is how I put it on. This is how I put the gate belt on. Is I'll hold this part towards me. Okay? If you're right-handed, you'll probably have the clasp in your left hand. If you're left-handed, you'll probably do it the opposite way. Doesn't matter how. Okay? Goes around. So one person says, shouldn't it be lower? I heard. Another person says, could it be here? It doesn't matter. Mike, does it matter to you where you put it?
No.
It doesn't really matter.
Unless there's like a.
If there's a
Yeah, if there's a exactly. Okay, so
But I mean, towards the hips would probably be better, but realistically, as soon as you start pulling on it, it's gonna go right up under, if it's a female, it's gonna go right under the chest.
exactly.
There's nothing you can really do about that unless you tighten it as hard as you can, but then that's uncomfortable for the patient.
Right, exactly. So again, I just snug it up like this, okay? Again, and then I'm just gonna clamp it up. So what I do is they tell us not to get in the patient's bed. They say don't sit on the patient's bed. Whether it's for hygiene reasons or whether it's for that's their bed. You weren't invited to sit on their bed, don't sit on their bed. Okay? But I always try and do a demonstration. So I say, here's what I want you to do. I want you to go ahead and lean forward, stand up, turn, and sit. So I'm going to demonstrate what I want to do first. And then so they have at least an idea what I want to do. Okay, what I want them to do. From this point, what's the next thing you want to do? You can do two things. One is I can bring her forward, so go ahead and scoot forward until her feet touch the floor. And so she's right on the edge of the bed. That's one way. This is going to be easier for me because she doesn't have that far to stand up. Another thing to do, let's scoot back, is you could lower the bed down. And when it's down, they can go ahead and put their feet on the floor. And so either way is acceptable. Okay? Mike, what do you like to use? Do you like to raise the bed up or do you keep it down?
As long as both their feet are on the floor to increase their stability when they're sitting and just making sure their hips are aligned. But if they're a little taller, then I'd like to have raise the bed up a little bit, just have them scoot forward so that both their feet are on the ground.
And then, so from this position here, come back in, or Susan, come back in. So from here, so now you want to get her to transfer. She's weight bearing, it's tolerated, she's modest cyst, and try that transfer one more time.
Okay, so come forward and put your feet flat on the ground. Good. Now come up, stand up. Good. So she's pretty good. She made it easy for her. She scooted all the way down.
You sit back there.
If
Yes.
you're not supposed to get on the bed, how would somebody like me treat Greg or Jack?
Yeah, I mean, it's hard not to.
Just don't tell him.
You ask for consent.
Well, that example was basically an outpatient setting. Yes. What do you, I mean?
I sit next to every single one of them.
Yeah.
Pretty much. I don't get right in bed.
Yeah.
I get right at the edge of the bed, especially if they're not stable. If I'm by myself, I don't have an OT to co-treat with. I sit right next to them.
Right.
Put my arm around them, chit chat, talk, hang out.
We'll show them.
If you ask them and they say it's okay, is that wrong?
No,
They do, the last thing they care about is you sitting up out of them. Make sure they're stable.
They
You're
say it
helping.
for hygiene reasons, that's all.
Yeah,
So you
for
don't carry
height,
it to the next
exactly.
patient.
So who brought the gate bell, try and partner up with somebody, okay? Open it up, so.